Good afternoon and welcome everyone. My name is Kristen Donhefner and I am the Measure 110 Strategy and Engagement Manager with OHA, and I will be assisting with facilitating today's meeting. The Oversight and Accountability Council welcomes and encourages community input. Members of the public are invited to submit public comments or get on our interested parties email list by emailing oha.measure110@dhsoha.state.or.us. That email address and more information about the council can be found on the Measure 110 OAC website. OAC members have asked that OHA and other staff who are present in the meeting space introduce themselves in the chat. Please share your role with the agency, and if you are a subject matter expert, your area of expertise. I will now turn this over to Amy to call the agenda for today.
Welcome everyone to our OAC meeting. My name is Amy Madrigal Bates and I am facilitating the meeting with Kristen today. We are going to have data collection and reporting discussion and some OHA updates today. And with that, I'll turn it over to Sydney for attendance.
Thank you, Amy. It is good to see everybody today. Thank you for joining. When I say your name, if you could please say it for the record, we appreciate it. Amy.
I'm here.
Hey, Amy. Carlos let us know he would be joining late today, which is very okay. Caroline?
Here.
Hi, Caroline. Dharma? No Dharma yet. It's okay. Hubert? Hunter?
Here.
Oh, hi, Hunter. Sorry about that. Jackie?
Here.
Hi, Jackie. Jonathan?
Here.
Hey, Jonathan. Keisha is not here yet. Sorry about that. Leticia?
I'm here.
Hey, Leticia. Linda?
Here.
Hi, Linda. Melinda?
Here.
Hi, Melinda. Meredith?
Hello.
Here.
Hi, Meredith.
Hello.
Morgan?
Here.
Hey, Morgan. Nicole?
Here.
Hey, Nicole. Onisha? Is not here yet. Ron?
Ron's here.
Hi, Ron. Ryan let us know he would not be here today. Sabrina. Don't see Sabrina yet. Zeb?
Yeah, I'm here.
Hi, Zeb. And then Sam?
I'm here.
Hey, Sam. And Annalise?
Here.
Hi, Annalise. And we have 17 present, and I'll keep updating if more people show up. Back to you guys.
Thank you, Sydney, for that. And we're going to go ahead and start with Kristen and Alfonso for the data collection discussion.
Thank you, Amy. It looks like Alfonso hasn't quite made it, but that's okay. We have a few of our other colleagues here with us today from Health Policy and Analytics Division. And we will be taking notes. So hopefully everyone can see my screen. But today we are here to talk about Measure 110 data collection. And this is really a request for y'all's feedback on data collection, on what is important, and what you might want to see in the future. We've had a couple community engagement sessions and surveys sent out around this, but you all are important stakeholders as well. So today is just to have a discussion, to collect feedback. There's no right answers or wrong answers. Just hope that everyone can participate and feel free to share your thoughts. So with that, oops, I think I have there we go. Sorry about that. I wanted to just frame what our current data requirements are as spelled out through Senate Bill 755. Currently, Senate Bill 755 requires the Secretary of State to examine outcomes for individuals receiving Measure 110 services. Thus, we are collecting, so we've been tasked with collecting information on the following: on overdose rates, on access to harm reduction services, on the number of individuals accessing services, on the average duration of client participation in services, the number of individuals denied services, the average wait time, and demographic data. And so this is all kind of what's in statute for what OHA should be collecting. Currently, we ask our grantees for the following pieces. We ask for aggregated number of clients served by service area. So within a quarter, how many people did you provide housing? How many people received treatment? How many people received a peer service? That kind of thing. We also collect the aggregated number of services provided, again, by service area. We collect aggregated demographic information. We ask for the number of persons who were denied services and why. We also ask for some qualitative information on successes and challenges of providing services under Measure 110. We ask for information about what kinds of outreach and community outreach activities our grantees are doing. And we ask for some service-specific information on types of housing being offered and types of harm reduction services being offered. What we currently are not collecting is client-level data, meaning personally identifiable information such as a birthday, a name, or a social security number. And we don't collect any additional outcomes data. What we do with this, as many of you have seen, we do publish this on a quarterly basis to a dashboard that lives on our website. This is a screenshot just showing the number of clients provided services by service areas. This graph here, you can see, has the number of people served has generally increased over time for all service areas. And we have kind of a separate page for all of those items you just saw on the previous slide. So we publish this information online. It's available to the public, available to you all, and available to legislators or the media or anyone who is wondering, what is the impact of Measure 110? So last week we talked about the Chapter 944 rules that we are preparing to update. We're also preparing a new request for grant applications for new grants starting in 2025. So we're also starting to ask currently funded partners in the community about what Measure 110 data collection should look like in the future. So we have 3 questions that are kind of up for discussion. Like I mentioned at the top, there are no right or wrong answers. We're just looking for y'all's feedback, suggestions, ideas, and we will make sure that we have a couple of people who are taking notes, who might ask follow-up questions, and we'll just have a conversation today. So the first question, and I'm going to put this up on the screen, but then maybe take the slides down and just repost the question in the chat so we can see each other a little easier. But the first question is about the cultural and linguistic needs of your communities or the communities that you live in or represent. And we're curious to hear from you all on what outcomes you believe are most important to measure when evaluating the effectiveness of Measure 110 services for your communities or your clients, and to what extent you're aware of current grantees' ability to collect data connected to these outcomes. So this is the first question. It's kind of a two-parter, and like I said, I'll put it in the chat, but stop sharing the screen briefly just so it is easier to see hands and to see each other.
Kristen, did you see Linda's question in the chat? I can send them out if that's okay.
Yeah, we can definitely share these slides. They'll also be posted to our website. And I just posted this question into the chat for reference. Always just find it's easier to see hands and see the chat and participate when we're not also looking at screen or slides. Sabrina.
I just want to make sure I'm understanding the question. So it's what outcomes do you believe are most important to measure when evaluating the effectiveness of Measure 110 service for your community clients? Taking in consideration the specific culture and linguistic needs for our communities?
Yeah, that's right. I think outcomes that might be important to some individuals or groups might not be as important to others. So kind of what do you think is important to be able to say Measure 110 is working or not? What things do you think are important to measure or to collect to be able to help answer that question? Amy.
First, I think it's really important to track customer satisfaction. I think that, a lot of our burns or our partners and stuff should have like a survey. They do Survey Monkey and stuff. What is working well? What needs improvement? Things like that. What services did you receive? What do you like? What do you see lacking? And I think those kind of things should be part of the consideration, just because, like in rural out here, right? We have a plethora of different cultural interactions, right? Many Native, Hispanic, the Black community, white community, everybody's intertwined in our little community here. And so we have, we look at what is the need, like some people need translators, some people need a different way to engage them. There are different cultures, right? We have the don't talk don't tell culture, and then we have the other culture that is being more kind of, I want to say, there's becoming more open to talking about things that have been hidden, generational traumas and stuff. So there's I think those kind of things are good. And like, what are you using to communicate with people? What kind of skill building, what are you doing? So what are their trainings? I think tracking trainings would be good.
Thanks, Amy. Those are all good suggestions. And I know last week, one of the suggestions that we took down from Onisha was also to make sure that we require grantees to post also, in addition to just general feedback, kind of a comment or complaint form to get some more of that those client community voices heard. And so I know that is a piece that we I haven't forgotten about, at least. I definitely wrote down last week. Kind of dovetails with that Sabrina.
Yeah, something that I always it's kind of parallels to this conversation I'm always interested in is the denial of services and the wait times and how that is reflected into our data that's on the Measure 110 website. I think I asked before, where is that data being reflected at? Are we sharing that data The reason why I think it's important is because we want to know how long our people are having to wait for ASAMs. We're wanting to know how long, you know, are people having to wait for services and being connected. But we also want to know why our people are being denied and turned away from services that are open to people. You know, that's what this measures for. And so I just always want to know where that plays into this structure and if that fits into this conversation.
Thanks, Sabrina. And I do not believe we currently publish either. I know we don't publish a number of individuals denied services, and we haven't yet asked about wait times. So just to answer those questions, but thank you for that comment. And I'm sorry, I think I saw Caroline and Onisha, your hands up at the same time, so I'm not sure who was first.
Well, I guess I'll go because my mute button's off. So I'm not sure if this is, well, we used to gather data here in Warm Springs because of the fact that the number of people who relapse, which is part of treatment, I mean, just part of, you know, addiction, is that there's going to be relapse. What we used to do, and I'm thinking of returning back to that, is to actually count the number of time, may it be days or months or years, where someone has been abstaining and then they relapse. And so what we found out, I think, when we used to gather this data, is the fact that relapse right after treatment was very short in duration. I mean, relapse happened quite rapidly. But as folks continue to go back into meeting their counselors, that relapse was further apart. And if they could make it probably at least maybe 3-4 years, the tendency to relapse went down. So, I mean, that is another form, in my opinion, of success, especially, you know, when we're looking at the new direction that we're headed towards in terms of meeting the client where they're at, where abstinence might not be the solution, but extended duration of being sober might be a good measurement tool. So just a suggestion. I'm just, you know, I know we did that for a while, and I'm thinking of returning back to that because I think that's a better measurement sometimes to see how long someone could not relapse. So just a comment.
Thank you, Caroline. Onisha. Onisha, if you are talking, we unfortunately can't hear you. All right, maybe we'll come back to you if you get your put it in the chat. Perfect. Thanks, Anisha. I know Meredith, you had some comments in the chat that I just want to make sure that I make sure I address. It would be important to see how many people have had to return to treatment. So the success rate after their treatment program, to allow us to see what programs are working and where we need to look for future programs. In addition, gathering information of the type of service the clients had and the duration of how long the program was. Yeah, I think that that's all really good feedback. Thank you. While I was doing that, I saw Linda, Morgan, and Duncan, your hands up, and I'm sorry, I was reading, so I didn't see the order. But I'll just go maybe in the order of my squares. So Linda.
I just had a clarifying question because I agree with people saying we need to collect data on people who are denied services and wait time. And that's in the SB 755 data requirement. So how is that being collected? Like, does Measure 110 ask that to be collected, or will that be collected separately so we don't have to also ask for it to be collected?
We are currently not asking about wait times. But Emily, please chime in if I say something wrong. I think our challenge in doing that is that we're not collecting individual client level information. So if we're talking about wait times, that might be the wait time for me, Kristen, accessing services, but not Sydney. Sydney got in right away, but I got in after a week. And so I think our challenge is kind of figuring out how to ask that question that takes into account both Sydney and Kristen's experience without having our names attached to that. So is that saying one client waited a week, one client was seen right away, multiplied that by however many clients you're seeing. Maybe I'm not doing a great job of explaining that right, but Emily, feel free to chime in.
Yeah, and I think you're definitely going in the right direction. And it does ask for an average. I think one of the challenges that we really have with that is just based on one, a provider's or partner's capacity to collect the information from like what the start point to the end point is for that, especially given the breadth of services that are provided. So, you know, for Kristen's example, person A might go to see someone who's providing housing services and she really needs to get into, or her goal is to get into, you know, maybe a more permanent type of housing or supportive housing. Person B might want or need a hotel voucher. And so, and maybe someone else needs help with paperwork to get into a different housing program. And so when you take person A, B, and C and you average their wait times, you end up with this number that's for housing, but for very different types of services for housing. And so when you have just such a variety of services that are being offered across providers, it becomes really hard to compare them and to use them in any sort of like evaluation or to really understand what that time even means. So we'd really have to probably break it down, not just by service area, but by like sub service area. And so knowing how difficult that might be for some providers, we just haven't gotten to the point where we feel like the effort that would go into that for all the service areas would match the power that we can get from it, especially knowing that they're going to be probably averaged into a number that we can't fully understand or appreciate the meaning of at this point.
Okay.
But I'm very open to suggestions on how to do that and what y'all think might be good alternatives to that wouldn't be overly burdensome for our partners.
Yeah, that makes sense. I could see how that would be a difficult number. I guess, well, one of my questions is that I don't understand what the SB 755 data requirements really means. So even though wait time is listed on there, we're not required to, like, we don't have to collect it. I guess I'm just confused. Like, what does that mean in relation to our data requirements?
So those requirements are for what the Secretary of State will look at in their performance audit that is due to come out next year. So in order for the Secretary of State's office to actually be able to look at these things, we have to collect them. By, you know, we also just have what's written in statute. So we kind of have to interpret the statute as we can. And since we haven't, to Emily's point, been able to really figure out a great way to collect this data point yet, again, open to suggestions. That is just a thing that we haven't gotten to yet, and a point that I think the Secretary of State's office may have a difficult time reporting on. And I think they have raised that as a potential risk in their previous two reports.
Okay, thank you.
Yeah. Morgan.
Hey, so just I'm thinking for the metrics, one of the ones I thought of is, how many people that come in get reconnected to the healthcare system. So how many people that haven't access to doctor or do not have OHP, one of those metrics, then, see a doctor or some type of medical professional or get on OHP. I just think it's really important to track people that are getting reconnected to systems of aid and support. And then also just how many people are meeting their self-defined goals. So if somebody comes in and says, I want housing, or, I want to get an ID, or I want to go to detox, how many people are able to complete how many of their own self-defined goals?
Got it. Thank you, Morgan. Onisha, your sounds like your audio's back.
Yes, I have audio.
Hey, there you are.
Perfect. Yes. So I reached out on our you guys are way far ahead, but I just wanted to add, I talked about it as far as collecting data. I think it's super important that we change the language in the complaint flyer that we have. I have it up in 6 different places at Community Club and in all of our offices. I think it's super important to our participants that they know that they can complain against any peer mentor, against any staff, that in addition to file grievance within that organization, which is their legal rights, they should be able to make a complaint to Measure 110 in the way.
Onisha, I'm sorry to interrupt you, but we're having a really hard time hearing you. It's just coming across as really choppy. Your audio isn't.
Can you hear me now?
Yeah,
Is
that's a
that
lot
better?
better. Yeah,
Okay.
yeah. I'm really sorry
Okay.
to interrupt.
No, it's okay. So the whole thing I'm saying is that if we don't change the language to make it mandatory that people hold those signs up in their organizations, we rob our participants of the knowledge to make complaints when things happen to them that are, and it doesn't just have to be about race. I mean, people could be having sex with clients. I've heard all kind of stories. People are experiencing all kind of stuff, and they don't know that they can make a complaint directly to the OAC about Measure 110 service providers. And we have the sign up. And I was working with another service provider in the burn, and she said because they worded the language, she was trying to get her executive director to make them put the sign up, and they said it's suggested, it's not mandatory. So even though they had some stuff going on that she couldn't complain about, but she wanted the client to be able to complain about, there was no space, or as an employee she didn't have the freedom to give that information to the client because she was scared she was going to lose her job. So, and then one more thing I heard I wanted to mention on uh the being denied services when we do the quarterly reports. I do the quarterly reports for our org, and I have had to say we denied services to somebody, but it wasn't because of a negative reason. They were sent to us because we were giving out gift cards and we had emergency hotel vouchers, but these people were not even ones who identified with having an SUD disorder. They were just simply in a domestic violence situation, and they needed funding, and they heard that we had these services and they were trying to get help. And when we did the screening, we were asking them, do you identify? And they said, no, I've never done drugs in my life. That's not my thing, and we had to resource them out to a domestic violence shelter where they did get services. But because of the way that we were funded through Measure 110, they didn't qualify for our services at Miracles. So I just wanted to say that.
Thanks, Onisha. And definitely, I don't disagree that complaint comment form is really important. So we will make sure that we can we look at our options for enforcing, displaying it in a business. Amy,
Was Duncan before me?
I can't remember. I'm kind of just
Okay.
going in order of the squares. I'm
Sorry,
sorry.
yeah, I didn't want to jump over, but real quick. So we have a large a large company here. And what they do is they report to a smaller committee that meets once a month, right? And they say, you know, what is your wait time for services? What does that look like? You know, and then they say people are coming in, and are they able to get in for tracking purposes? Are they able to get in right away, or do they have to wait? You know, they're out clear till July to get people into their mental health program, clear till July, sometimes August. And so, but then they look at the the SUD side, and the SUD side is a little bit better. They're about 2 to 3 weeks out. So, and that's how they track. It's not how they're tracking each individual little tiny service. It's that they're tracking services entering into services. How long does that take? So I get where you see, because there are, it's like a big piece of machinery, and there are 1,000 moving little parts, and you can't track every single little part. I mean, you notice a part of the machinery when it breaks, but you're trying to, you know, keep the machinery moving fluidly. And so in order to track some of those things, you track some of the bigger elements first, and you keep it going that way, right? Instead of saying, you know, how long it took them to, you know, access services for housing, for those things. I mean, you are, how long did it take for them to get into services? You know, I guess that's kind of where I'm coming from when I look at it. You know, like our wait time in my clinic is, in my office is 1 day, you know, sometimes 2 days. It just depends on availability. So then we look at things like that. But I don't look at like they got in there that day, but they had to wait for services. So to kind of tracking it like that maybe might be something that would help kind of dumb it down a little bit.
Thanks, Amy. That's helpful feedback. Duncan.
Hey, hopefully I'm not going too far off topic or I'm missing something, but one thing I'm always seeing is that there's not much of a show for like program outcomes and all that. And what I'm thinking about towards is just showing like programs as a whole, like changes within it. One thing I've done on a smaller scale is PHQ9 and GAD7 during enrollment, and then again at 6 months to find like any positive change and all that, so that way we can make sure we're adjusting and all that. And then there's another large peer program that I'm working with that does a modified GIPRA, where we're able to like see on a bigger scale, like how many people are getting into housing, how many people are cutting back use, and all that. Because when it comes down to what people want to see is people want to see higher numbers into inpatient and all that, and that's something we cannot provide because we are maxed out on that. Every bed's filled and there's a waiting list. So I think looking for bigger data sheets to show like positive change in any direction. Specifically, somebody said, sorry, I think it was Morgan, engagement into medical systems. One of the numbers I'm most proud about with my programs is seeing emergency room visits drop down and enrollment into primary cares and urgent cares go a lot higher. From my experience as somebody that's used is you don't get good medical service and you get a lot of stigma in the emergency room. So people are getting better health care. Problems with trying to roll that out though is that all the agencies would need a lot of support with a system to gather all that and be able to track it.
Thanks, Duncan. I think that's really helpful perspective. Good feedback. Not too far off topic either. Sabrina,
Yeah, I'm familiar with GIPRS too, and they do it at the first month and then the 5th to the 8th month just to grab some real raw data for SAMHSA, but it's also a little heavy. But I wanted to go back to my original question about the denial and the wait times, and I don't want to beat a dead horse, so we can follow up with this offline. But I was just wondering why it was on the slide deck if we're not gathering that information, and then I get confused about what's statutory in 755 and how that aligns to the questions we're already asking. And then my main concern is why it was on the slide deck if we're not asking those questions in the first place. I think maybe we could remove them.
So they're on the slide deck because they're in statute. They're in the law. We can't change those. Only the Oregon legislature can change what's in the statute. So those are the things that they are telling the Secretary of State to look at. And we have not been, they are not on the second slide. We're not collecting them because we haven't found an effective way to actually get at collecting what we are being asked to collect. Does that answer your question?
But you guys do ask it though. On the quarterly report, you ask those questions. So it is being collected.
We ask about denials of services. Yes.
Yeah.
Yeah. We're not asking about wait times though.
Oh, yeah. Right.
Yeah. Ron.
No, I was just following up on a point you're just making, which is just questioning you said we're not asking about wait times, so we could just ask, right?
I think Emily discussed some of the challenges of asking because it would be kind of an average at this point of across various service types. I think our challenge is if we ask, are we actually getting a meaningful response and data point from that question? Sure, we could ask how long does it take to get into your housing program? But I think the question that we would get in return from our providers is, well, it might be 1 day for a voucher, but it might be 2 weeks for our residential program, and it might be a week for our transitional housing. So do we take the average of that? And then is that a meaningful portrayal of like what actually the wait time is? And so suddenly we would be asking a lot of questions that are very, very service specific for kind of each subtype of services that our providers are providing.
Yeah, I'm just reading through this, what's in the statute. Number of individuals seeking assistance from the network or recipients who are denied or not connected to SUD treatment or other services, and the reasons for the denial. The average time it takes for a client to access services and fulfill their individual intervention plan, and the reasons for any delays, such as waiting lists at referred services, or whether average times to access services to which clients are referred, such as housing, medically assisted treatment, whether those times have decreased over time since, and that's really kind of I can see how it could get pretty muddy.
Muddy is a good description.
Yeah.
I mean, do you want to revisit the chat? Meredith put in if we could look at the overall cost of programs and what type of insurance a client has, if any of them for attend the program, because this could be a barrier to services. And also looking at location of the programs as being important because location can play a part in being a barrier because of a lack of support systems or transportation needed to get them into a program. Those are very good points, Meredith. Melinda put in measure how many programs also support housing specific to BIPOC populations. A good suggestion, Melinda. And Linda agrees with Melinda. In addition to housing, maybe the number of beds in a culturally specific treatment program, such as residential beds, supportive housing. Good comments. And if you, any of you have kind of sit and marinate and think on this after our meeting and have additional feedback or thoughts, definitely feel free to send those to us. We'll continue to collect them because I know this is a very meaty topic. And Linda, I just see you put in the chat about how many language services are offered, or services that are different language. That'd be easy to collect. Thank you. Well, we have another question for you all. I'll put it on the screen and then we can put it in the chat again. But this question, happy to also revisit the previous one, of course, is how can OHA support organizations with collecting data for any of these outcomes? And this question is really, you know, for people, I know several of you are organizations that are currently trying to collect and report this data. But I know a lot of you are also connected to partners in your communities. And we're really wondering how we can support collecting this data, since as I think a lot of folks have noted, it's not always easy or straightforward to get at. So if you have suggestions or feedback on what kind of support that we as an agency can provide to collect some of these things. Amy put webinars are always useful in the chat. Yep, sure are, Amy. Hunter.
Yeah, I think for some of the smaller, like some of the like Measure 110 startups, such as the agency I work at, data collection is tough when you're trying to be HIPAA compliant with all the things, and also sometimes using like Excel and Word documents is all that we have. Sometimes we don't have any EHR. And tech budget lines and all those things, when everybody's having a little bit of money they have for different things, is hard sometimes. Not only my agency, but I know of several other agencies in our burn and other burns that I've talked to that like help with an EHR would be great. I don't know if that's even possible, but and I know it would be. It's hard when if that money came from somewhere else, like if that was like OHA tech support to help these smaller agencies that have trouble with that protection, come up with the technology to do it, like an EHR or something like that. And then OHA would, what numbers you want to collect, what type of things you could help these agencies with.
Thanks, Hunter. I think that's really helpful perspective, especially from as you put more of a startup agency group, still building out programs. Sabrina.
Yeah, I just kind of want to piggyback off what Hunter said. We use it for Prime Plus, and we're in 21 different counties, and a lot of us are rural communities. We use a database called Recovery Link, and Recovery Links captures all the inclusive data and engagements and everything, and it's really user friendly. When I first started, I barely knew how to navigate, computer systems, and I've been able to be successful in it as well as teach my team. But it gathers I always say, use the analogy, it goes in there like a butterfly net and scoops out all the data you want and then puts it in a report card for you. And so it's really user friendly. And I don't know if that'd be helpful to you and or for Hunter, anybody watching, but it's been very helpful to us.
Thanks, Sabrina. That's a great analogy, I think.
Can you put that in the chat, Sabrina?
Request for putting the name in the chat. Thanks, Amy. Yeah. It's recovery link. Sabrina just put that in the chat. And Duncan wrote, that was my thoughts, some kind of EHR or data collection software service. Thanks, Duncan. Yeah, Sabrina?
Yeah, and I don't know if it's too far-fetched, right? I'm not saying like OHA would use that, but I mean, it's really collect because it could collect like the engagement you have with your person, like from the moment they sit down to the moment you leave, and the goals and all of these different things. I heard like, when we're talking about denial of services or wait times, like the moment we start working with them until the moment we don't work with them anymore, or the repeated times they come in, or all of this stuff. And like we work with Co-Imagine and OHA a lot on this project, and they're able to type in exactly what they want or what information they need, and it supplies its own, with the butterfly net supply, it creates its own Excel document pertinent to the exact information that you're looking for.
Thanks, Sabrina. Hunter.
And I'm sitting here reflecting on the previous question and this question. If there was an EHR, I mean, to be honest, I guess financially supported from somewhere. I'm not saying it's come from OHA or whoever, but for agencies that don't have one, and something that was like provided for it, that would help. Like from the moment, a lot of them have like the little iPad to where when you come in, you check in when you walk in the door, right? Those are like encounters that you would have, and then it tracks that moment, and then when you finally get to your appointment, it would track that moment, and there's your wait time, right? And so something like that could track a lot of these things, right? Like if somebody was denied services, when they walked in, they entered their demographics quickly. It would have to be something like very, quickly, like first, last name. Even, it doesn't even have to be that, right? It could just be, we have a sign-in sheet, the front door, and I don't care if you write Mickey Mouse or whatever you want. We're just trying to, track how many people walked in the door at that point. And then if they're denied services, that's entered as well. So like an EHR simplified with that net that Sabrina was talking about, I think would solve a lot of these questions.
Thanks, Hunter. That's helpful feedback. I think one maybe kind of follow-up question I have for this group, curious to get y'all's thoughts, is a challenge we have run into is for people either providing services in the field, in the community, at kind of a community engagement event, or providing harm reduction services. So those that are traditionally very anonymous for a variety of good reasons. If there are strategies or ways that folks here have thought about collecting good information about those client encounters, because they might be fleeting. You might not be in a place where you really want to get, Hunter, to your point, all you get is that it was, Mickey Mouse was visiting because people don't want to give their names for, again, really good reasons. If there are ways you think about that kind of data, and just how meaningful it is and important, given that those encounters are sometimes the very first kind of entry into the continuum of care for individuals in the community. Yeah, Hunter.
I think for encounters, I mean, we have Narcan, but I know there's many other people on the screen much more qualified to talk about harm reduction than us. But such as like outreach, things when we do those things. A lot of the things that peers do are in their communities, and you know, with lived experience, we know where we're navigating, and so keeping track of those encounters and being able to enter those later on when you get back to the office and the HR, I think is something that a lot of us do in here, right? Like in the beginning, for outreach, we used a clicker. We used a clicker for how many individuals that we talked to, right? And so, because like in the, I know like what we're talking about is outcomes, and we need to be able to make sure that the people that give us the money are still, you know, doing those things. But I think more importantly, it's the people that are struggling on the street that are getting the services that they need. Right? So, yeah, I don't even know if that answers the question or it's just some feedback.
No, no, that's helpful. I think, what I've said is we never want answering a question to be a barrier to receiving a service. So it's kind of striking that balance, right, between making sure that people get whatever they need, but also kind of finding a way to measure that because ultimately, at the end of the day, we're all accountable for these funds, and we want to make sure we are able to measure their impact. So, yeah.
Kristen, was your question specifically to like outreach events? How do we get people engaged, or was it across the spectrum?
It was kind of across the spectrum, but I'm thinking specifically of events or services that are a little bit more anonymous,
Yes, for us in
not
a
in the
rural, because
office.
yeah, because we work in a really, I mean, a lot of us work from rural communities, but our community is still very small and rural, and we're under the scrutiny a lot. So the eye of the governing bodies and the authorities. So when we do things, we have to move a different way, right? And so, like Hunter said, we've either collected the data later, and that's why I love Recovery Link because you can go back and add our data from later. But then we also incentivize our people, right? It's the casual rapport that you build with them at the outreach events that kind of create them to want to have further contact with you right there. But instead, I definitely try to incentivize our people to come to the office, so we can get some more headway into helping them and support them.
Thanks, Sabrina. That's really helpful perspective and feedback. Linda.
I was thinking about what Duncan said about collecting surveys, GIPRAs, and then what Onisha was saying about having like a form available for people to report any complaints. Does the OHA have the capacity to administer like an anonymous survey to people who are actually receiving services about the organizations that could get at some of these outcome measures?
I know we have talked about it. I think the challenge is how we reach people, right? Because that would obviously require working with our partners then to kind of facilitate making sure we get people clients that survey. So I think it's definitely something we would like to do in the future, and would welcome feedback on kind of what that looks like and how we could best partner with our grantees. Because I agree, Linda, that end user voice is really, really important. Amy, I see your hand up.
Yes, with Linda, your question. One of the things when I had an experience a while back, and one of the things that I was able to refer a client to was the OHA or the OAC ballot measure 110 website, right? They can go on there if they have a complaint and file the complaint on the website. So, there should be, I think we should make it, clients are often told about their rights and responsibilities, what clients' rights and responsibilities. There's also supposed to be a grievance procedure posted in all facilities and stuff like that. But I think we should, if they're ballot measure 110 recipients, maybe we should be asking our recipients to make the clients aware that they have a right to go to the ballot measure 110 website site and, say what we're doing well and what we're not doing well, or, if they have a complaint or an issue, they're able to go there. I think that's one resource that I know was out there.
Yeah, Amy, and I think that's the resource that Nisha has called out for really wanting to make that required and not optional, right? Because sometimes, for whatever reason, a provider might not want to post a link to that feedback form, right? And get called out for maybe things they aren't doing. So making sure that isn't framed as optional, but required. And I think, what I'm hearing, Linda, maybe you suggest is more than just kind of a open comment form, but a little bit more structured questions around, okay, did you receive a service? How was it? Kind of more targeted questions versus uh, open, just drop your comments or concerns here, but a little bit more proactive in that questioning. Is that right?
Yeah, and to get more at the outcomes of like, did this organization support whatever your goals might have been, whether it's housing to get into treatment, was there a change in your substance use severity, and those types of things. Of course, that can get very, very long. But if there's a way for us to make that short, maybe using some pieces of these evidence-based surveys that Duncan brought up too. And then I feel like, I don't know how much funding OHA has, but if OHA gave like $5 gift cards for people to fill out the survey and then required organizations to get just a certain number. But then we would really be hearing from the people who are using the services.
Thanks, Linda. And Sabrina.
Yeah, I like what Linda said, and that could be like a follow-up to your other question, or the same question that you asked about how do we get people engaged when we're in a public setting to kind of get them into a more private setting to capture data. And I know that we're still working on RFGAs and all those kind of things, but maybe we can make a portion for that, like, hey, X amount of dollars can go to incentivizing people to get real-time, real feedback from the people that we're serving. And they could maybe put it in their budget.
We can look at that suggestion. Thank you, Sabrina. Okay, I think we have just one more question, and then again, it's pretty open-ended, but I will put it on screen and then take it off and put it in the chat. But this question is, what opportunities can you see for Measure 110 reporting to the public in general? I think we've shared the dashboard many times, but I know that there's always probably ways we can better share data, or maybe we're missing things. I think we're interested to hear what we might be missing in terms of what isn't being collected now that should be, and if there are opportunities that you think we should take advantage of in general. Okay.
So I guess I'm going to ask a question to this question. So it says, what opportunities are there for Measure 110 reporting to the public in general? Is there going to be funding from OHA to make these reports public? I think that if you were to go ask the public in general, what kind of data had they heard about Measure 110, it's not going to be any of the data that any of us have collected. And if I was to walk down the street right now, I do not think that many people, if any, if I asked them the question, would have been to the website and looked at the data, right? Because, but if you ask them what was on the local news that night, they might know, right? Because it's there for them to consume. So I think to this question, I would ask, like, what can OHA do for Measure 110 as far as getting that data more accessible to the general public, and not what other data points can we give to the general public? Because I don't think the general public is really getting the data that we have right now.
Yeah, that's a good question, Hunter. The legislature did authorize funding for a more public awareness, a public awareness campaign, that kind of thing. But that does not go into effect until 2025. So unfortunately, at the moment, we're a little bit stuck waiting for that date to be able to use funds for that purpose. But I think that's a really great point. Sabrina.
Okay, I'm just going to be really shooting for the stars with this comment, okay? So it's parallel to what Hunter just said, but in my community, we have a newspaper that comes out 3 times a week, right? And in my community, I don't know if I've ever seen or heard of anything speaking to Measure 110. So I think it would be nice if the sky was a limit to have like a quarterly report published in our newspaper so people could have something tangible to what we're doing. Because I know I get updates to my work computer from OHA, but how many people are going to be receiving OHA updates, and how many people, like Hunter said, are going to know how to access the website to be able to navigate? And I think to be inclusive and equitable in our publishing of that information, if we could, I think it would be great to do it that way. Or if quarterly is too much, at least periodically, because like I said, we have no real-time data or information straight from OHA landing in the hands of the public that I know of in my community.
Thanks, Sabrina. That's a good suggestion. Zeb.
Thank you. Yeah, if we're shooting for like pie in the sky, which I like that, it'd be nice to see billboards up all over the state, with a link to the website, all the positives that are, all the positive numbers that have come out of Measure 110 and the impacts, because I think we see billboards all the time. It seems like there's far more stories that are negative on Measure 110 than are positive. Now, granted, you have to have some money to back up some type of campaign like that. It sounds like we have to wait till 2025. But that would be really nice to see. And, I was at the OPAC conference a couple weeks ago, and there were some presentations given by programs that had received Measure 110 funds. And those are very powerful to hear what they've done with the money. And they all had their own stats, impressive presentations. I don't know how we can expose the public to stuff like that, because like not everybody can make it to an OPAC conference. The average citizen isn't going to that. But I don't know if there's some way, to highlight these programs. I know we have the website, but something funneling stuff to the website or whatever would be great. Thank you.
Yeah, thanks, Zeb. And I think we have all kinds of lists, taking notes, but I think that's a great starting place for what a media campaign could look like next year. Because believe it or not, it will be here. Next year will be here very soon. And so doing some of that preparation work is definitely a good idea. Just want to make Hunter, I see your hand, but make sure I respond, call out some comments in the chat. Linda said that the public was very interested in increased housing and treatment beds, Perhaps that's data we could collect and share, the number of increased supportive housing beds, residential beds, withdrawal management beds as a result of Measure 110. Linda, I think that's a great suggestion. Definitely something we can consider adding to our website and our dashboard going forward. Sabrina agrees with billboards, with maybe even QR codes. About that suggestion. Although worried about using a QR code if you're driving and looking at a billboard. I'll just put that out there for public safety. Don't drive in QR. Make sure a passenger is doing that. And Sam put in it's helping the public distinguish the legal components of Measure 110 and the service delivery system that you are all creating for people throughout the state. I think that's also really important to draw. And Hunter, I want to make sure that we don't forget you.
I just wanted to highlight Sam Byer's comment with the way that the Measure 110, the way it's been treated in the media, and that could really help separate the two components of Measure 110 with the decrim, recrim, and then the money to help struggling human beings, right? Because there's not a separation in it to the general public, and without the funding for it, we really can't continue to try to help make that separation. If you work in the field or if you're involved with Measure 110, you understand that. But other than that, the general public, there's really not a separation that I've seen.
Thanks, Hunter. I think that, yeah, an important point to make.
Kristen, can I throw out sort of a follow-up-ish question?
Absolutely. Yes, Emily. Thank you.
Kind of just piggybacking off of Zeb's comment, because I could not agree more. Just like reading through all of the responses that come in through our current question about like program successes. They really high programs are, and they do all have, some statistics, but not every program has the same numbers and the same statistics and the same goals and successes. And so one thing that we're hoping to move kind of more toward with this program is not just quantitative, like numerical values for evaluating it, but also for looking at more qualitative measures that folks can respond to. And so I just wanted to put for qualitative questions that you think might be good for eliciting some of these really unique highlights for the programs, or that would help probe at some of the unique successes. Anything that you like from your organization's perspective, if we were to ask you a question where you could type in a response or a short answer that you think would be really important for it to highlight to the public or to legislators or whoever, if you could throw those out or send them to us, those would also be great. So just want to put that out there if we have a little bit of time left.
Thanks, Emily. I think that's a good question, and definitely an area where we would love your feedback. Well, folks are just chewing on that. I'll just call it a few more things in the chat. Amy asked about burn conferences like peer gatherings, and Sam responded that we're working on developing some regional burn learning collaboratives and gatherings. So looking forward to that work starting soon. And Linda suggested, since our meetings are public, could we host a meeting dedicated to sharing outcomes, maybe invited funded organizations to tell their story about what they think of the funding and encourage the public to attend. I think that's a great suggestion, Linda. Definitely something we can consider for future agenda. And Hunter wrote that you hosted a burn bash for all the agencies in the 3 burns in Lane County recently, and it was amazing. I love to hear that, Hunter. That's great. I don't see any other hands up, but as I mentioned, this is definitely not your only or last opportunity. If you think of something or think of good qualitative questions or anything, please make sure you just send those to Sydney and she'll make sure that we get them. Really appreciate everyone's um, feedback and questions. I think this has given us a lot of really great food for thought and suggestions. So just really appreciate you all being willing to take up a Wednesday afternoon to talk about this. We are not meeting, I think, for a few weeks because of the way the calendar falls. So our next meeting will be June 12th. I do expect we will have votes at that meeting, and we'll be talking about the RFGA and funding that's going to be available for next year. So definitely not one that you will want to miss. And that'll be June 12th. So second Wednesday in June. I think we have a few OHA updates for the group. First of all, I want to just take a moment to apologize. I misspoke last week during our OAC meeting on rules. We were talking about the screening rule and then the assessment rule, draft rule. And a question came up about what our Measure 110 phone line is funded to do. And I incorrectly said that they also, in addition to screening, they can do ASAM assessments, and that is incorrect. They are only funded to perform screening. So I'm really sorry for that mistake, and I just want to take the time to correct that record. Really sorry for confusion, my confusion in the heat of the moment, and hope that didn't do too much harm to folks by giving that bad information. So definitely apologies for that. We do have another community engagement session tomorrow, Thursday at 9 a.m. Unfortunately, due to some technical difficulties, it will not be live streamed, but it will be recorded and the link will be posted to YouTube as soon as the meeting concludes. But the Zoom is open to anyone who would like to join. So definitely encourage folks to participate if you can. I think I'll turn it over to Sydney. You have a few updates as well?
I sure do. I know Zeb said at the beginning, but I just do want to thank everybody who came on Friday. I think we had a really productive training session. I know I missed the afternoon part, but I didn't hear any difference from the OGEC trainers, so I think that went well as well. I will be meeting with the E&I team tomorrow and about a makeup session for the folks who missed or want to attend again or anything like that. We're going to get that set up virtually for everybody because that was not recorded. And the ethics training was recorded, so I'm working, actually have the link ready, but I'm waiting on the other information to send it all to you all at once. So look for that to come probably next week. I know I said this week, but with Carly's also out this week, so I'm doing a little bit of juggling. I apologize. So that's that update. And then the other update I wanted to share is we are restarting our work to get you all your equipment and get you all using the same equipment, working through the troubleshooting and all of that stuff. So I am creating a survey to send out to all of you it'll ask you to verify the numbers on your computers and your identifiers on your phones to make sure that you have the ones that were assigned to you. We don't anticipate that being an issue, but just to make sure so we can pass it on to our new set of folks that is helping us through this process. And also trying to get everybody using their state equipment going forward. So that just to let you know that process is going to start, and I hope to get that survey out to you also early next week. I'm still working out all the details with OIS, but those are my updates, and I appreciate you all again. It's always so nice to see you all in person and not just boxes with yellow lines around you and you talk in these meetings. So it was really look forward to having our next one, which we will probably have in the fall sometime. So also be ready looking for that. Lots of things.
Thank you,
Thank you,
Sydney.
guys.
Thank you, Sydney.
Thank you, everyone. I think that's it. Amy, I don't have anything
Thank
else
you,
unless you do.
I'd like to thank
Bye.
everybody for attending the meeting today. And thank you for all your input and everything. It's really valued, and it allows a place and a space for every party to process what they're doing and come up with ideas as well. That is what this is about. Like we said, this is a new program, and we're still growing and we're still learning and gaining information, and it's going to be wonderful. So I appreciate every single one of the OHA staff that supports us and makes this possible, that we are a successful OAC team. So with that, have a great rest of everybody's day.